humor major, author, and founder of ELIXIR Wellness. Our guest today on the Settle or Be Better podcast is Tanya Khubchandani Vatsa, who's going to be talking to us about the all-new healthcare services available to us that can help us take our well-being up a notch. So over to you, Tanya ma'am. Why don't you tell us a little bit about the story behind ELIXIR and how it started?
Absolutely. Firstly, thank you, Sakshi, for having me. So, ELIXIR started a year ago. This is, for those of you who don't know, it's my own wellness startup. I am someone who has a lot of experience in healthcare. I worked in the US in healthcare for many years, in primary care and chronic care. And then during the lockdown, I just felt like so I run a cancer hospital as well, and I just feel the number of illnesses and the amount of disease we've seen, there has to be a way to sort of get ahead of it. So I started researching the wellness space and seeing what they do abroad. And IV therapy is something that is huge abroad. So that was the first goal when I started ELIXIR. And as we've expanded into the space, I've been studying and researching and meeting people, and I have realized there's so much more in the space that's happening worldwide that we can do. So that's the goal. I want ELIXIR to be a one-stop shop for everything anti-aging, wellness, and preventive care.
That sounds absolutely amazing. We are very lucky actually to have ELIXIR in India. It's in Mumbai and Bangalore for the ones who don't know. And
Yes, so we will be in Bangalore as of March 8th. We're opening in Bangalore March 8th. But currently we have 3 centers in Mumbai and 2 more on the way.
lovely. I'm waiting for it to happen in Pune very soon.
Fingers crossed.
Yes. So tell us about IV therapy. Let's begin there. What is it exactly and how safe is it to go for it?
Absolutely. So this is a question we get a lot. IV therapy is basically intravenous fluids. What we give you is minerals, antioxidants, and vitamins. There are no medications involved, and it's completely things that are natural to the body. So unless someone is like vomiting or in an acute situation where they need medications that will be doctor prescribed, everything we give is natural to the body. Our primary and our hero ingredient is glutathione, which is something that the body makes that gets less over time. A lot of our formulations are actually centered around glutathione because of its incredible benefits to each organ, but it's something that's natural to the body. So we get a lot of questions about safety. How safe is this? Everything that we use is natural to the body. There are things that are found internally as well that when we have deficiencies of cause a lot of issues. And then this leads to the question of what if it's an overdose? But again, everything's also water soluble. So if if it's something that you're not deficient in and you take it, it's not going to harm you, but you are going to have it come out of you in urine. So it'll get your levels to a point where they're good, where they're sustainable, and the rest is coming.
Right. And does anyone need to consult their doctor, their own doctor, before getting into this, getting an IV therapy?
So we actually have a panel of expert doctors. We have like an obesity and metabolism specialist. We have a homeopath. We have dermatologists. We have MDs. So we have 6 doctors on board. We have doctors on an advisory board as well. We have a pathologist involved. So no, you don't need to consult your own doctors. If you have recent reports, you can definitely bring them in. My doctors will take a look. If they need any tests, they will ask for it. But our doctors are very well equipped to handle absolutely anything.
That's lovely. And I have had the experience of visiting ELIXIR, so I can definitely vouch for that it's a great consultation that you get before getting an IV therapy. And it's not just like you go and you tell what you want.
Yeah.
It's a good consultation and they know what your needs are. So it's absolutely.
So that's the thing, because we have such an extensive menu, people kind of try to shop from it and be like, okay, I want hair and I want skin and I want this and I want that. And I'm like, no, come in, talk to our doctors and they will help you assess what you actually need. So don't try and shop from our menus, come and do a consult instead.
Exactly. That's true. And it's really lovely. So what are the common vitamins and minerals that people usually choose or are recommended amongst the variety of the IVs that you offer? What is the most common?
So I would say glutathione, like I said, which is an antioxidant is the most common. It's pretty much in most of our formulations, even like the health and immunity ones have that because it's something that detoxes the body. Collagen and vitamin C are again really popular and they go well with gluta. So when you put that in with gluta, the glutathione actually becomes more efficient and easier for your body to take and to absorb. So these three actually together make our skincare range.
Right.
Funnily, glutathione is something that started as a cancer drug and to detox the liver. And as it was used, they realized that the side effect is this beautiful, glowing, deep pigmented skin.
Right.
So it makes up, and it's not a drug; it's something natural again. But it makes up like our skincare range. We have an amazing
Right.
anti-aging IV, which is like collagen, vitamin C, and zinc, magnesium that are great. Zinc and magnesium again are super popular. Zinc because when it's in the hair fall IV and it's
Right.
amazing and for immunity as well. And magnesium is something to just helps relax your body. I mean, I'll tell you, I took a shot of magnesium yesterday because I've had like a week of like stress and insomnia. And I slept last night after 10 days, which just felt like I feel like a new person today.
Right. That's great.
It's
And
also amazing for migraines, actually.
oh yeah, absolutely. I mean, magnesium is one of the vitals that we need.
Yeah,
Definitely, it's one of the
absolutely.
best supplements to consume and
Yeah.
to have in our radar. Definitely. So, how does this go along with supplements? Like, if someone is consuming these supplements already, and they want to go and get an IV, how does this work? Like, how often should one do this, and how does it work with the supplements that they're already consuming?
So what I would tell you is that so much research has been done on this space and supplements, glutathione in particular, but other supplements as well. Glutathione, the absorption through the gut is less than 15%. Most supplements, at most, you're getting 20%. So even if you're taking something that's like 400 milligrams, what your body is absorbing is less than 20% of that. And then even then it goes to the liver and the kidneys and you don't know where it ends up. So, I mean, there are people who are averse to having needles. There are people who are averse to actually putting something in, and we understand that. But again, what you're getting is so much more efficient. The body uses it better. It goes directly into your
Absolutely.
bloodstream, and so you actually, if you're taking, like for example, I was taking magnesium before I started the IVs a year ago, and I no longer take those supplements orally. In fact, I don't take anything orally in terms of supplements. I have medications that I take for like polycystic ovaries and stuff. I have a tablet that
Right.
I have to take. That's pretty much all I take. I'm not taking anything else in terms of supplements, vitamins, or anything orally. And if you're regular with your IV therapies, and by regular, I don't mean you have to come in every day. If you do
Right.
so the way we advise it is to front load, do a course of 4 to 6. Your levels get to a
Mhm.
point where they're sustainable, then you can go up. Just do one a month and you're good. Even like less frequently, you can even do 1 and 2 months. If you're someone who's just taking energy or immunity or something, you can do like one a month to begin with, and then even
Right.
taper that down, and you don't need any other supplements.
Right. Okay, yeah. So we know the obvious skin benefits with IV therapy, right? I mean, that's one of the main goals people come in with. Even I came in with my friend and she was like, okay, I want to get my skin care on right time and
Yes.
that's what I want. And she was in with that goal. So obviously that is something which will absolutely help us given we might not be able to complete those needs completely through our diet. But what are the other needs apart from skincare that this helps us with in terms of longevity, biohacking? How does this exactly work?
Absolutely. So, immunity and wellness is a major one. Beyond skincare, a lot of our therapies are formulated to actually detox your body. So, it does
Right.
reduce the free radical exposure in the body, it reduces the oxidative stress in your body. We're
Right.
soon launching something that is known literally to clear out all the dead cells from your body.
Oh,
So, we
lovely.
have a lot coming. So, that literally is biohacking. You are extending the your cells ability and longevity because you're clearing out the dead cells from the body, you're reducing the stress, you're reducing the cortisol level in the body. In fact, I was reading a study 2 days ago, so I'm working on an oncology specific menu. We do have a lot of cancer patients who come in, and antioxidant therapy is something that's given abroad now, even with chemotherapy. And there are so many studies, and these are well funded studies abroad that show that glutathione actually reduces when you for someone who has tumors or someone who has who has an affinity or a genetic disposition towards cancer, it even reduces the spread and reduces how fast that actually progresses. So it's got amazing benefits even beyond, well, way beyond skincare.
Absolutely.
I would tell you for a fact that my migraines have come down from 20 a month. During lockdown, I was on anti-anxiety and all kinds of meds. I've come down from 20 a month to three. And even the three that I have, I was at a point where I don't know what my triggers are. They would that often, like anything would trigger me. Now I'm at a point where I'm like, okay, if I'm starting to feel it, I know that I've skipped a meal or I've done something that like I really shouldn't do. Because now it's just so much more controllable. My productivity is so much higher. I feel like I'm happier and lighter. So that's, yeah. And are very, very popular too. Uh, one of them is actually a metabolism booster. I would say that as much as people come in for the skin, they come in for that. It's really well priced, and the reason it's much better priced than the others is because you need fewer of them. The ingredients are fewer. It's basically something that pushes your body to burn stored fat. We use carnitine, which is an
Right.
amino acid again that's normal to the body, but it pushes you to sort of, and it works really well with diet and exercise. So when you put the package together,
Right.
I've lost 13 kilos myself. It works beautifully. So that's one, and we have a very popular hangover drip actually that we tend to send home on the weekends. Yes.
That's a very interesting one that I found on the menu. It was
Yes,
really
and we do a lot. So we do home care across Mumbai, and the
right.
hangover is something that we do very often at home.
So if you're the life of the party, you know where to go and
Exactly. Even if you're not the life of the party, if you're like me who gets a headache in one drink, even then you know where to go.
right. Absolutely. That was a great insight on IV therapy because I myself also, when I got that done, there were so many people asking me about so many doubts and like, how did you get it? Is it safe? What
Yeah,
was the intention? So definitely that answers the
yeah,
questions. Coming to compression therapy,
yes.
tell us a little bit about that. What is it exactly? Is it only for athletes, or how do you begin with understanding that?
No, so actually, we have. I'm not going to take names because we're big on patient confidentiality, but we have athletes who come to us regularly. We have Bollywood stars who come to us regularly. Actually, most of them do home care, so rather we go to them. And I would say that last week we did a cricketer and we sent the compression therapy home for him to try it. And he actually said, he was like, I have my own one. This is something that I do every day. So, yes, it's phenomenal for athletes. We've even had like the SOFA team in here and they all tried it. But beyond athletes as well, if you're someone who works out regularly, if you're someone whose muscles get sore, even if your immunity is low, so what compression therapy is targeted to do is actually lymphatic drainage. So it clears out your lymph nodes, it helps your body, your blood circulate better. It's these sleeves, it's literally sleeves because there's nothing else to call it. We have three sets. So we have them for the legs, for the arms, and for the hips. And they're sleeves that through air pockets compress your legs or compress the body part that they're on, and they give you an air massage. But of course, it's intense. It's not painful. The intensity can be fixed according to like your threshold, but it clears out soreness completely. It clears out fatigue. It boosts your metabolism because it kind of drains your lymph nodes. And it's absolutely amazing. I did it myself yesterday again. I was just sore from having three really long days and working out. And I am not an athlete by any standpoint. So anyone can do it. So if someone has a blood pressure issue, we don't do it simultaneously to the IV, but otherwise we do it before after. But just so
Right.
that because you shouldn't have fluid going in and the compression going on simultaneously. But you can do
Right.
15 minutes, you can do 60 minutes. We have people who come in and will do 20 minutes on all three body parts. We have people who come in and do a 35-minute or a 55-minute session. So it's something that's gaining
Right.
popularity. In fact, we had two between our three clinics, and we just ordered a third one because I feel like I constantly have one person running around with it comes in a
Right.
backpack. So I have one person
Right.
on a scooter with a backpack going back and forth. So we've just ordered a third set.
Right. That's great. And how often should one opt for compression therapy?
So this depends on how often you work out and your lifestyle, but it's something that, like I said, there are athletes who have it at home. Uh, this and like a massage gun, it's safe to do absolutely every day, multiple times a day.
Right. 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 That's amazing. And coming to cryotherapy, so I mean, definitely people have started being more aware of it now, with ice baths and cold showers and Wim Hof method and all of those things. But what you offer at the clinic is way different than what people are usually doing right now. So, what are your thoughts on cryotherapy through ice bath versus the one that you have at Elixir Wellness? Like, who should opt for which one, and how do they differ with the benefits?
So there are two types of cryotherapy. One is a full body chamber that you actually go and immerse yourself into. The other one is this local application. So we have the full body chamber coming at our new center soon. Actually, it's already been ordered. So we have a flagship center coming up, which will literally have everything under the sun, and the full body cryo will be there as well. Currently, what we have, which personally I'm someone who hates the cold, so I find this much easier. It's a local application. So it's like a wand or a device that actually gives out this liquid nitrogen that when it comes out, it's in a gaseous form. And you put it on the joint. It does feel cold, but it's not unbearable in any way. Like I said, I'm someone who can't stand the cold, so it's very, very tolerable. In fact, yesterday my kids came for an event where we were doing cryo, and they were like, "We want to feel snow," and so we actually put it on their hands and their face. So it's completely, completely safe. I mean, nitrogen is something that we breathe in
Right.
through the air on a daily basis anyway. Um, but what's amazing about it is that 6 minutes of cryotherapy from the wand or 3 minutes in the chamber is equal to 21 hours of icing. So, I mean, you can immerse yourself in an ice bath until you're polar bear, but you're not going to get the benefits of like literally a few minutes of cryo. So it reduces inflammation, it
Right.
increases your circulation in the joint, it causes healing, it reduces the stress on the body. It's amazing for the face. Like I did it the day we got it on my face. And I'm someone whose hours are so crazy. I literally don't have a chance to do a facial, even though we have a whole range of facials. But this I do. I'll tell them just run the wand on my face, and it reduces your pores. It reduces any kind of swelling. So if you're someone who has like puffy eyes or soreness or like a heavier face, it reduces that as well. It tightens your skin. It causes collagen generation under the skin. So as an anti-aging tool, it is fabulous. My grandmom actually, who is someone who hates leaving the house, has come in for at least 5 sessions because she's like, that's the only thing that gives me benefit for knee pain. So even in a situation with knee pain or arthritis, it's amazing.
So, do people usually with some sort of injuries and like joint pain specific to an accident also come in for that?
Absolutely. So my husband actually had fractured his foot. And he was had this pain. They call it a Jones fracture. The pain was just not going, and he's been doing cryotherapy regularly. In fact, I think he's stopped now because he's back on the tennis court playing. Like it's actually healed his pain to that extent. It works on muscle soreness. It works on joints. It works on nerve pain, and we have a really fabulous cryofacial as well. That's amazing.
That's lovely. I mean, that's something definitely that needs to be, more spread around with people. People need to understand when to apply
Yes,
heat and when to apply cold
absolutely.
with some sort of an injury or some sort of a pain. Because usually we tend to apply heat, it's more
Yeah.
comforting, and we have this notion that, it might help us
But
heal.
actually, it's the opposite. It's the cold that reduces the
Yeah,
inflammation and heat
exactly.
increases it. So, yeah.
Exactly, exactly. So that is something definitely that can switch and people can apply.
Absolutely. And this is safe. It's not uncomfortable. You don't feel like you're sitting under like in an ice bath or anything.
Right,
It's very comfortable.
right. I mean, of course, if you're brave enough to get into ice baths, just do it.
I'm
But
not
not
at all. But like I said,
not many people who are very
yeah,
afraid of getting into
yeah,
ice
yeah.
baths.
I'm not
Definitely, it's
someone
a
who can get into
great
an
thing.
ice bath, but this literally is equal to 21 hours of icing one session.
Right. That's something I didn't know. That's very interesting. So this is amazing. Like, I mean, obviously, people you can reach out to Alexa or Tanya ma'am, and you can learn about all the amazing other services that they provide. But these three are the ones that personally stood out for me, and of course, are gaining popularity for all the right reasons. So these were really amazing ones. And what would you say are the services that people, choose opt for who are the elderly crowd? So what are the services that they usually opt for their wellness?
So for the elderly crowd, our cryotherapy is really popular because there's always some kind of ache or pain or something that you're uncomfortable with. We have an anti-aging IV that does really well, and we actually have introduced recently HIFU, which is high intensity frequency ultrasound, that is basically a facelift. It's a non-invasive facelift. It works just as an ultrasound wand on your face. You can do it on your body as well for
Right.
skin tightening. We have a client today who's coming in for their arms, or like pockets of fat. But what it does is it generates deep heat, and that heat produces collagen, and the collagen reduces wrinkles. It lifts your face. So post actually a HIFU session, it's completely painless. You actually see over like 10 days, and then all the way up to 3 months. It takes 3 months to get that full impact of the collagen. It's a natural way of boosting like your body's own growth factors, and you see a change in your skin. You see your lines getting less. You see your face being firmer, and it lasts up to a year. It's really, really fab. We also have Botox and fillers for those looking for a quicker fix, but HIFU, I feel, is something that's much longer lasting and safer.
Absolutely. Absolutely. That was great, Tanya ma'am. So this concludes our episode today. It was very informative. Is there something that you want to leave us with? Any thoughts, any suggestions, any message for the
Absolutely.
audience?
So I want to say that there are a lot of misconceptions about IV therapy. One is the safety, which we've addressed. The other is that like you take one session and a new person. It doesn't work like that. It does take a few, but we have doctors who guide you through it, tell you what you need, and explain the entire thing beautifully. And so, I mean, we're expanding fast. It is for a reason. These are therapies that are helping people. We have not even been open for a year, and we've done close to 2,000 clients now. These are unique clients. So
Very
thank
amazing.
you. So I am very proud of the success of Elixir, and I know we have plans for it to grow at like an amazing trajectory. So I just want to thank you for hearing all about it, for asking us about it, and I'm looking forward to doing more, to talking more, and to seeing hopefully some of your podcast followers also coming in to check out Elixir.
Absolutely. Thank you so much, Tanya ma'am, for today and for this insightful episode. It was definitely helpful, I'm sure, for a lot of viewers who didn't know about any of these services available to us now with all the new technology and everything that is accessible to us, so accessible in India. So that's really great. So don't miss out on doing that little road trip and traveling to the nearest city and your nearest venue that is available to you. Because I myself am from Pune and had the opportunity to visit Mumbai. I'm definitely going to do this more often.
Thank you. We look
Until
forward to seeing you back. And yes, that's definitely in on the plan at some point, even though it's not in the immediate one.
right, of course. So thank you. That's it for today. I'm Sakshi Pawar. I'll be your host for the Settle or Be Better podcast. Stay tuned as we bring more inspiring stories your way. Thank you so
Thank you,
much.
Sakshi. Thank you for having me.
You know the drill. Subscribe to the Settle or Be Better podcast. Like, share, and comment on our videos. And hit the bell icon because you don't want to miss the mind boggling health discussions we're about to bring for you. Why settle when you can be better?